Hi, everyone. Mrs. Godwin here. Let's look at Chapter 9, the chapter that you've been reviewing this week and learning about. The first thing that you want to do is develop a safety culture. Safety practices can reduce the occurrences of injuries and exposure of a worker and patients to potentially dangerous microbes and hazardous materials. If you look at this diagram, this is an approach to developing a safety culture. Let's look at some of them. Commitment of management, worker participation in safety planning, adherence to written safety guidelines, availability of proper protective equipment and supplies, your PPE, identify and remove hazards in the workplace, determine cause of identified problems, provide employee education, introduce safety culture at initial hiring, promote individual accountability, and last, give rewards after success. What can we do to ensure patient and employee safety? If you look in your book on page 84 and 85, you will see box 9.4. All of this gives you behind the scenes safety activities. Keeping records up to date, making sure equipment is working properly, required documents to include in exposure control plans and safety data sheets. Records include employee medical records as well as training. Try to look at behind the scenes safety on page 84 and 85 for a better understanding. It gives a great detailed explanation of everything. What are some other areas that need to be addressed before patient treatment? Reviewing patient records for any special patient needs, ensuring cleanliness and asepsis of the clinical laboratory, reception, restroom, and check-in areas. Making sure cough etiquette supplies and signs are present in reception area. Ensuring that operatory has been properly prepared for using surface barriers and performing cleanliness and disinfection. Distributing the necessary instruments, handpieces, supplies, disposables, prostheses, and equipment, and ensuring the availability of PPE, hand hygiene supplies, and other sharps containers. What to evaluate and how to evaluate. If you look at the slide, you will see examples of infection control elements that can be evaluated. These recommendations are from the CDC. Immunizations of the office staff, which needs to be updated annually. Occupational exposure to infectious materials. Post-exposure management and follow-up. Hand hygiene procedures. The use of PPE. Surface asepsis procedures. Monitoring the sterilization process. Evaluation of safety devices. Microbial quality of dental unit water. The use of disposables, sharps and injection safety, and waste management. Let's look at how infection control benefits patients. The vast majority of infection prevention procedures performed in the dental office relate to patient safety. Some procedure benefits both patients and dental personnel, such as protective eyewear for the staff, aspects of waste disposal. Let's look at some of these slides and the examples given and see how it benefits the patient. One, let's look at hand hygiene. If you look at hand hygiene, it removes or kills transient microbes and may reduce resident microbes on the hands of dental personnel that otherwise could contaminate patients upon direct contact or through a torn glove. As we know, gloves can have micro perforations in them, so washing your hands is a good habit to get into. Wearing your face mask. Face masks may reduce respiratory droplets from the dental personnel from the contaminating patient. Also, let's look at divided instrument processing areas. This would be your clean side and your dirty side. Why do we have that? It reduces the chance for the intermingling of non-sterile with sterile instruments, preventing cross-contamination of the patients. Examining wrap packages of sterilized instruments before opening. Why should we do this? This ensures that packaging material has not been breached during sterilization, storage, and handling, and that the instruments have remained safe for the use of the patients. If your instrument has been punctured or something has torn, do not use that on your patient. Make sure that the autoclave strip and the indicators on packaging has changed the proper color. Sterilization monitoring. There's 3 types of sterilization monitoring. You have biological, chemical, and mechanical. Sometimes this is done every time you package an instrument, or it's done once a week. It needs to be documented. This ensures that everything is working properly. Telling a patient not to close the lips around the saliva ejector. This can cause backflow into the patient's mouth. The use of a rubber dam. This reduces exposure of patients to microbes in the dental water unit and reduces the chance of microbes entering root canals during endodontics. The use of disposables. This is one of the easiest ways that we can prevent cross-contamination. When you're done with it, you throw it away. Maintenance of infection control equipment. We want to make sure that everything is working properly. This helps ensure cross-contamination, such as the instrument cleaners and sterilization. Office policy on infection disease, work restrictions, and exclusion for dental personnel. This prevents exposure of patients to potentially infectious dental personnel. Housekeeping. Reduces airborne dust levels in the office, which helps prevent surface contamination of items used for the patient care. Another thing that you could do as well is when you're wiping your room down and you see something that does have a collection of dust, wipe it down. Surface barriers. Surface barriers prevent cross-contamination from one patient to another from touched surfaces. The same thing with surface cleaning and disinfection. Let's look at how infection control benefits the dental personnel. Regulations and recommendations. All offices should have a blood-borne pathogen standard, a hazard communication standard, and infection control recommendations. All staff members should have education and training. Employers provide training on blood-borne and infectious disease at the time of initial employment. There should be a written health program recommended by the CDC, and it should include medical conditions and work restrictions, immunizations, allergic reactions, and post-exposure management. This week, you also had an assignment with dentalcare.com, and it was the clinical practice guidelines for infection control, exposure control program in the oral healthcare setting. This was actually a downloadable file that was in that you can see for an exposure what would be filled out if you or one of your coworkers were exposed. This is something that you would have to fill out. As always, if you have any questions, please feel free to reach out to Miss Little or myself.